first time I've had the pleasure of being at the college since I've been here, besides to some of the functions that you've had at the auditoriums. But this is certainly the first time I've ever had the pleasure of saying anything about chiropractic. Chiropractic is a quite controversial profession in some people's eyes. Of course, to me, it wouldn't be too controversial. I've been around it all my life. I have two uncles that are chiropractors, but they themselves were not the reason I got into chiropractic. I got into chiropractic, I would think, because of our close friends that we have. It's funny that our family was closely related with chiropractors, not just my uncles. And when we moved from Montgomery, Alabama to North Carolina, we became quite close with two of the chiropractors in Greensboro, North Carolina. And I had attended Georgia Tech for 1 year, and I still was at the stage where I still didn't know what I wanted to do. And I spent all summer in a kind of a daze. I didn't really want to go back and go into civil engineering, but I did, but I didn't, but I did. You get to that stage, I imagine all of you have been into that. So finally, my mother one day, she just said, well, have you thought about chiropractic? I said, no, that didn't cross my mind. So I just got on the telephone and called one of the chiropractors and went down there and talked to him about it. I didn't know where to go. I didn't know a thing about the schools or anything. I did know what it would do. I had seen results that my uncles had gotten in previous years, but why I never thought of taking it up, I'll never know. So anyway, I got into chiropractic that way, and I have not regretted it at all. And with the amount of time that we have here to try to get across to you the philosophy of chiropractic, what it is about, would really take as long as it took me, 4 years. Because it's a constant thing, not of brainwashing, but of the understanding of it. It is different than medicine. And you cannot learn it in 30 minutes time, an hour's time, 5 hours time, 10 weeks time. You can't do it. The manipulation part can be done, can be learned quite easily. But it's the application of the adjustment, as we call it, the manipulation, that is the hard thing to grasp as to the direction, the amount of force, the conditions you would use it in for a specific movement. And with time slipping away, I better get into the philosophy before time's up. I could rattle on and on. So I'm not going to make this real boring. It could be boring. I could go right down the line and list this, list that, list this, but boy, there's nothing any more boring than that. So what I'm going to do is just hit the theological basis of chiropractic and make a few more statements, and I'm going to throw it to the floor. You can ask anything you want. I'm not saying I'm going to answer them or can answer them, but I'm going to try. Now, the basis of chiropractic practice. They can be summed up in 5 principles. Number 1, that a vertebrae may become subluxated. Number 2, that this subluxation tends to impinge the structures passing through the intervertebral foramen, that is, the nerves, the blood vessels, and the lymphatics. Number 3, that as a result of such impingement, the function of the corresponding segment of the spinal cord and its connecting spinal and autonomic nerves is interfered with, and the conduction of the nerve impulses impaired. Number 4, that as a result thereof, the innervation to certain parts of the organism is abnormally altered, and such parts become functionally or organically diseased or predisposed to disease. Number 5, that adjustment of a subluxated vertebrae removes the impingement of the structures passing through the intervertebral foramen, thereby restoring to diseased parts or malfunctioning parts their normal innervation and rehabilitating them functionally and organically. Now, those are the 5 principles. Now, we could look in 5 different books and come up with a different list, but basically they're all going to say the same thing. There are 2 national organizations. One says it should be done this way, and the other says it should be done that way. Well, basically, that we're still saying the same thing in the long run. One says that we should do it all by hand only, using nothing else in conjunction with the treatment. I will go along with that to a degree, but I feel also that we should have freedom to use any modality if you have been so trained, so instructed, and are so licensed to prepare the spinal column or joints of the body for the manipulation. Now, every state has a separate, well, let's put it this way, every state that is licensed, and at the present time I think there are only 2 states that are not licensed, and I think they are Mississippi and Louisiana. Now, I might be wrong there. One of them might have it. I think, no, neither one of those have it. Massachusetts finally got one. But every state has a different definition. But basically, again, they say the same thing as far as the treatment of the spinal column is concerned, and the only other difference from there on is what the state allows you to do in preparing the patient for the manipulation. State of Indiana, the definition is this: the separate and distinct science of locating and adjusting the articulations of the spinal column for the purpose of treating human ailments by the removal of nerve interference. Now, before you can practice in the state of Indiana, the graduate is, well, this is what I've got written here is outdated already. You have to have 2 years pre-professional training, pre-professional college. And there are suggestive subjects to take at that time, though at the present time it's not necessary, it's not by law saying that you have to have this subject and that subject, but you've got to have 2 years pre-professional training before you can go to the chiropractic college, before you can even enroll in it. And this type of law, this type of upgrading of the profession is changing faster than they can keep it in print. I know that. Because when I was in school, the majority of the states, all you had to have was 4 years. And then finally, a lot of the states went to, you had to have 1 year pre-professional and then 4 years college. Now it's 2 years pre-professional plus your chiropractic college. But when I was going to school, there were very few states that required 2 years then, and that was between 1951 and 55. But at that time, you could take your pre-college training. It wasn't required pre-college. You could take the extra training while you were attending chiropractic college, and a lot of them went to Purdue and Extension in Indianapolis while they were going to chiropractic college. But now it's getting stiffer and stiffer. All right, then after he gets his degree, he must pass a comprehensive examination prepared by the State Board of Medical Registration and Examination in such subjects as anatomy, chemistry, bacteriology, physiology, hygiene and sanitation, and pathology. Now, this examination is the exact examination given at the same time for medical doctors and osteopaths. You sit down in the same room with them and take the same examination. Then, after that exam is over, it's followed by an examination in the science of chiropractic therapeutics, which is administered by the chiropractic member of the medical board. And if you get past that, you're all set for this state. Now, what about the training in chiropractic? Is it worth a doodle? I can name a school right now, but since I don't have the full information on some other schools that come to mind, I won't even bring them up. I'm not even going to mention the name of this one, but I can name one school right now that the training is not significant for chiropractic, but you can't get into this state if you graduate from that school. There's only two places they can go then: Mississippi, Louisiana. It's the only place they can go. So I don't know what benefit it would be, and people can yell all they want to about the education and all, but if they're going to use this particular school as an example, it's not a very good example. When you pick one where you can't even get into the state after you graduate from. So the chiropractic colleges that are upgrading continually their subjects and the instructors, they are the ones that are going to do the best job for the individual one that wants to become a chiropractor. He is the one that's going to do the school is the one then that's going to do the best job in getting good chiropractors out. And a good state law will have to keep these schools on their toes. And that's what's happening. Now, this school I'm going to mention is the one I graduated from. I will mention something about another one. Of course, I know more about my own school than another one. I don't know how your system is set up here, and it's been so long since I went to Georgia Tech and Lincoln Chiropractic College that I've forgotten how you figure how hard so many units is. They go by units. What are units now exactly in per semester? Like they've got 25 units. It's 480 hours is what it amounts to. They're on the semester system. They have 3 semesters a year, which would go year round then. So two semesters actually equal 1 school year. Well, they average out, it looks like, at 480 hours, besides not counting your last 3 semesters, and they go up to 560 hours. So that's not, for a full year then, that's 960 hours a year. And then it goes up another 80 for the last 3 semesters. See, this school is 9 semesters. So that figures out then 4.5 years. You can compare this to any medical school, and the total number of hours in a lot of subjects we're going more than equal the medical school in certain subjects. I know the first argument coming back from medicine, well, you don't have the right teachers. They don't have a degree. They don't have this. They don't have that. So that's a pretty good argument. Let's see what they do have. Well, maybe I better save that question until I throw it open to the floor and let someone ask something specifically. But here's what has happened with National Chiropractic College in Chicago. 2 degrees are offered by National College, a Doctor of Chiropractic and the Bachelor of Science in Human Biology. Both the DC and the Bachelor of Science degrees are approved by the Office of Superintendent of the Public Instruction of the State of Illinois. These are accredited courses approved by the State Teacher Certification Board of the State of Illinois. The library that they have there holds membership in the Medical Library Association and the American Library Association. The clinical diagnosis laboratory of the college is licensed by the Department of Public Health of the State of Illinois. The college is listed in the Illinois Directory of Schools and the Education Directory, Part 3, Higher Education, U.S. Department of Health, Education and Welfare, Office of Education. This is as of 1966-67. Now this information right there, if the schools didn't have something to offer, they couldn't even get that much recognition. And ever since I was in school, the Veterans Administration has been paying tuitions to the chiropractic colleges. Now I'm going to throw it over. It's the easiest way because there's just so many things I could just keep rattling on about that you might have some specific things in mind that you'd like to know about the profession. And I probably would never even get to them. Any questions? Anybody?
Doctor, would you care to tell us the school from which you graduated?
Lincoln Chiropractic College in Indianapolis. That's right.
You didn't mention many of the other schools other than the one in Chicago.
Okay.
Could you care to mention maybe one other one which you think, or I guess according to the laws of Indiana, meet the requirements for licensure in Indiana?
All right. Palmer College does in Davenport, Iowa. Now, a few years back, one bad facet of it, there wasn't anything really wrong with it at the time, but as a person that's not in the profession glances at it, it doesn't look too good. They think that the Palmer College was a money-making organization. Well, it had to be, since at that time it was a private college. If it didn't make money, they'd just go broke. Now it is not a private college. They're, I guess, what do they call them? Corporations? And they're all incorporated now. Well, at least, if that's the terminology to use, the tax-free organization, non-profit organization. I can list some of the other schools that are, I thought I could, well, I can name them from memory anyway, that are in the recognized group of the American Chiropractic Association. Now, they have withheld some of the full recognition to these schools until they meet certain standards, and exactly which ones have already met it, I am not sure, because this has been going on, this upgrading has been going on at a rapid pace in the last 4 years, and I don't know exactly which ones are in and which ones are not yet. They're all tentatively approved. They just haven't added on certain things that were required. And it'd be the Logan's College in St. Louis, the Texas College, I forgot the name of it, in San Antonio. I think I'm correct on that though. That might be under the other group. There's a school in Minneapolis, Chiropractic College there. There's the Columbia School of Chiropractic in New York City. The Toronto Chiropractic College in Toronto. The Western States Chiropractic College in Portland, Oregon. And the Los Angeles Chiropractic College. Now, those are the main ones I know anything about. As far as you go into any of the others, I don't. I have no idea what the curriculum even looks like.
Dr. Langford, you mentioned some of the basic science that you have to pass the test.
Right.
I was wondering how much you actually had on the field of psychology.
Psychology?
In your training.
Well, when I was there, let's see. I remember we had 2 semesters, and if they're still going on the same basis of how many minutes to each class and so forth, it'll probably be about 160 hours. Let's see how that figures in here. Psychology, you say? Total hours, 240 hours for the entire school year. That takes in personality development, 96 hours. Psychopathology, 64 hours. Counseling, 80 hours.
How many credits or hours per class? For any, for amount of class, you say there's semester. Now we're on quarters and we get, say, 4 hours for some classes.
That must be what they mean in here by units. Be like, I guess, so many credits per class, so many units credit per class. For example, 80 hours, you get 4 units credit. I'm just looking at one. Chemistry is 112 hours, and you get 5 units credit. I guess it's so many hours, you get a unit of credit. Would you like to hear just what first semester sounds like? Anatomy covers osteology and arthrology. And anatomy covers histology. This is all first semester now. Chemistry, inorganic chemistry. Then chiropractic orientation, terminology, and history of the healing arts. And physiology, principles and body fluids. Psychology. That's where the first step of psychology comes in. Personality development. That's first semester. And of course, as I remember, they get much tougher as I look back. Anything about the profession at all? Pro or con? I saw this one first. You probably had it up first. I saw that. She's great. Go ahead.
We talk about the adjustment of the spine. Now, is this the cracking of the back, or what do you do? How do you manipulate the spine? I don't understand that.
All right. The term cracking is an easy term to remember, an easy thing to bring out when the word chiropractic is even mentioned. The noise cracking that you hear is nothing more than the same noise you hear when you pop your knuckles. But in the thoracic vertebrae, the ones running from your neck down to your waist, to the end of the rib cage, you don't have one joint for each vertebra. You have 2 articulations with the vertebra above, 2 articulations with the vertebra below, and you have at least 1 articulation on each side for each rib. And in some of the vertebrae, they actually have 2 articulations on each side. So you have anywhere from 6 to 8 articulations with each vertebra itself. So if a chiropractor specifically moved one vertebrae without affecting any of the other vertebrae, you could hear a combination of 6 to 8 crunches, cracks, snaps, any term you want to use. You ask how we went about it. It is done either by a specific part of the hand or the fingers. And you always use a little leverage. I don't mean by a 10-foot pole put off on one side, you know, and to get a running start and whack them with it. But specific leverage in a specific spot. Hardly ever do you use just one hand when you're doing it. You want some leverage, so you use 2 hands. I guess the only other way I could show you would be to demonstrate, but since I have no volunteers, what's your...
Would you care to describe some of the recent chiropractic research?
Recent research, all right? At the present time, dating back to possibly about the time I got out of college, Dr. Eli, which is a good name since we're dealing in bony structures, is a chiropractor in Switzerland, and he has done extensive, detailed research on the spinal column from all facets of it. Cleveland Chiropractic College, one I did not mention, is in Kansas City, and they have done much research with animals and human beings, but you can only go so far on human beings, whereas they can on animals. For example, they would take an animal and subluxate all the way up to dislocate a vertebra in a particular area and keep, of course, scientific data on it and what would happen when it was partially replaced to its normal position or wholly placed in its normal position. Plus, in the Lincoln School, they developed, at the school they developed, an X-ray machine that would take movies of a specific area of the spinal column in motion. And they're catching it from that angle, what actually happens with the spine, what happens with the adjustment, and the effect after the adjustment in actual motion pictures of the spine. Now, of course, I've seen some, I have not myself taken one of the classes where they have gone over these specific things in research in the class. I have just seen short sections of it where they just tried certain things, you know, and of course they always put the unusual thing and the funny thing in there, like I think they had on national television one time where what happens in the cervical region when a boy kisses a girl. So, and they had both of them in front of the X-ray machine kissing. So, what kind of position you have to get your neck into, and so forth. That type of thing. That's all I've seen of that. As to other research, there are projects going on. As to the exact detail of them, I do not know. I do not know.
This is in regard to that question.
Right.
To your right, there are 15 names on a blackboard. Put those there as chiropractic leaders. Are there any of those that you would disagree with or want to be crossed off that list?
Disagree with?
As far as
well, I'll tell you this. As far as what I remember about the detailed history of the chiropractic profession, my first thoughts when I was in school, I said, this history is fine. It's all right. The profession's got to begin someplace. But time does change things. The profession is not limited like some want it to be limited to one specific thing for everything. We found that out in any field you go into. They said, oh, this is the way, and they find out that they're wrong. It's not the way. Sometimes you have to go this way to get there. But do I disagree with any of them? I will disagree with anyone. I don't care who it is, I'll disagree with them on something they say if they say enough. So do I disagree? I'll disagree with this man, I'll disagree with that man on some things. But on the whole, I will agree with what they say. But I'm an individual too. I know they did research when they were getting into this and they were bringing this about. They did their research. Well, all of us tend to do our own research to a degree, whether it's under specific laboratory conditions or not. And that's like saying he says treat such and such one specific way and that's it. Well, he's probably right in 95% of the time. What about the other 5%? Didn't have an opinion on those? You're supposed to just cut the head off, throw them in the garbage can, or what? So I do disagree with certain things that they say. A lot of these names I have seen, but I don't know a thing about them. I'll go along with him real well. And this is just going back to history. I'll go along with a lot of things he says. I don't think it's wholly true, everything he says.
He's the founder of the Logan School.
Right. That's correct. This was one of the founders of Lincoln, right here. They split off from Palmer because Palmer wanted it a certain way, everything so. So I remember something about him, but I couldn't tell you what it was. And a lot of these names are real familiar and all, but I don't remember that much about what each one said. If I can see what they said, then I'll make an opinion on it.
Okay, I'm specifically interested right now in a statement made by Kimball in regard to your answer on research.
All right.
In November of 1964, Kimball, addressing fellow chiropractors, urging them to do research, made the statement that not a single advance has occurred in the last 25 years.
Well, now, 1964, you say? Mm-hmm. Okay. As of 1964, at that, now you said, he said, wait a minute, not a single advance. Did he mean advance in the profession or advance in research?
I took it to be a research advance.
All right. Now, if he meant advance in the profession, any chiropractor could tell you that that's not so because of the different viewpoints that have come about in the treating of certain conditions. Now, you're talking about, let's see now, wait a minute. These projects were getting underway at that time, or were a year or two in it at 1964. I don't know where he got his information. The only thing I know is what I read. Anything else?
I wanted to ask you what your source of information was on your National College of Chiropractic statistics that you gave, the listings and so on.
Those things I read on came from the school, for one.
School?
Yes. Now, I think I have some.
You said it was listed in the Educational Directory, Part 3, Higher Education, United States Department of Health Education, Welfare Office of Education,
Yes.
1966, 1967.
Right.
In that entire edition of that book, chiropractic itself is not listed. The National College of Chiropractic is not listed. National College is not listed. Lombard is not listed. And there is not a listing of chiropractic colleges of any kind in the state of Illinois.
Well, I don't know why.
Well, you said it was there. I looked with my eyes and it's not.
They said it was there.
See, that's the same piece of paper I have.
Yeah,
I looked it
right.
up and it's not there.
Well, there's evidently an explanation for it then. They didn't get their information out of the air either.
It's not out of the book either.
Well, just tell you what, I'll see what I can find out.
Okay.
Through the college.
Back on the bottom of the page.
Right, I know which
you have
one
the
it
same
is.
one I had.
Right. Okay.
I would, if you can find it anywhere, I'd be thrilled to death because I
Okay.
went from one cover of that book to the other.
Okay, I'll see, and I'll find out why it was listed if it was not there. Okay?
All right, I believe in a second, I'd like to ask you just one
All right.
question. The chiropractic makes much of adjusting vertebrae. Do they take into consideration maybe muscle spasm or heart?
Oh, yes. Oh, yes. All right, now, you bring that point out. What is you bring the term musculospasm up. I don't care what they call it. They've got all the fancy names. Well, you hear them all the time. You hear pinched nerve. You hear musculospasm. You hear slipped disc. You hear slipped vertebrae. What else is it? I don't care what they call them anyway. Because what has happened in all of them, now I'm not talking about someone that ran out and, like I did when I was back in high school, reached up to catch a pass and my muscle in one of my legs went into spasm, Charlie horse, and I ripped part of the muscle. That wasn't set up by a subluxation. Or was it? Was it a what's the term? Predisposed conditioning of the muscles that would not allow that muscle to stretch or go through that amount of exercise or movement without some form of reaction by the muscle, and in so doing it spasm. Now that I can't say for sure, but anyway, on any of these vertebrae, you will find where there's a subluxation, you will always find in a subluxation a malposition of the vertebrae in relation to the vertebra above and the vertebra below. That malposition then sets up a compression, even though it's a light compression, of the intervertebral foramen opening where the nerve fibers come out, and that light pressure then will set up, depending on to the degree of it as to which comes first, a swelling of the tissues in this opening, which is surrounded by bone. And the more swelling you have then, the more congestion, of course, and that is swelling. And then the more pressure you have on the nerve. Now, any pressure or irritation you get on a nerve fiber causes the tissues, or in this case muscle, to act abnormal to a degree, depending on how much, again. And if it is muscle, it usually always starts to swell. It might not go completely into a spasm where it'll put you on the floor, but it will start drawing somewhat. Now, I don't mean it'll keep drawing and just go all the way into that solid spasm, but at times you've all had subluxation. No doubt some of you have subluxations now. It is the degree of subluxation that can floor you sometimes. I doubt if there's anyone in here that hadn't gone to bed at night sometime during their life where something was wrong someplace in there. They knew it, they didn't know what it was, and they said, well, it's a muscle or it got cold on the back or something. And they go to bed, and when they wake up the next morning, it's gone. Now, well, if that's the case, if the body can correct itself, why do they need a chiropractor anyway? They don't always. It's just the time when the vertebrae gets in such a position and the muscles are in such a position that it's impossible for it to correct itself without a little help. Now, even some of these that do come in, they will eventually, a lot of them will eventually get over their trouble. But do they want over it this week, or do they want over it in 6 months? That's the thing. If they would like to speed up the process of recovery, okay, we can speed it up for them. Some of them will come in with a severe stiff neck and they can get over it immediately. Then the next case of a stiff neck, it'll take 3 or 4 days. It depends on the case again and how much damage was done when it went out. How did it go out? How have the muscles been affected? How have the nerve fibers been affected? Anything else before we ramble on here too far?
Sir, this question is derived from an observation that I made just by chance. I happened to see a full-length X-ray, and I learned that it was from a chiropractor's office, and this happened to be in Ohio. And so I have sort of a series of questions from that observation. Right. One would be, I'm curious as to the amount or the degree that these full-length X-rays are used, or was this just an old piece of equipment that this one chiropractor happened to have? And then secondly, if it is used, what's the justification as far as overexposure to some areas and underexposure to the others? I just can't envision a machine that can correct exposure factors for the various thicknesses and composition. And then thirdly, I'd like to know if you see anything in the soft tissues, say calcification of an artery or that, is this brought into your final diagnosis, and, or is it just ignored or what?
No. For the body to function normally, you've got to have the proper nerve supply, proper blood supply, proper lymphatic drainage, and proper nutrition. Now, I'm talking about calcification of the blood vessels. That would be one phase of it that's in trouble. The circulation evidently isn't what it should be. And usually if you'll find a patient that has calcification in an artery, they've got a lot of other things wrong with them too before it gets in that shape.
How do you treat this then? How do you treat, say, calcification
of an artery?
Yeah.
You can't change it. You can try to improve on the general circulation to the area, because the body is at all times trying to heal itself. It's doing its best to heal itself. It's just when the body finally, as a person gets older, that naturally their overall enzymes and other chemicals that are produced in the body when they're younger, that they diminish more and more and more, and finally certain symptoms begin to develop and they begin to deteriorate. We all start dying when we're about 30 years old. We're going downhill.
Would you improve the circulation to the area?
It has always been known that with an infarct in the heart muscle, that the infarct itself, that tissue is dead. You can't change that. You've got a dead plug in there. But the patient's not dead, and there's not a muscle yet that does not try to compensate for something that has happened to a part of it. And that's all this is done with an infarct in the heart, is to give the heart muscle time to add more muscle tissue and more blood vessels, of course, which you would have in muscle tissue anyway, to compensate for the bad spot. And of course, one of the main treatments is rest at first, to give it time to try to compensate for it. You can't go in there and just cut it out. Well, they could. They're doing everything now. Operation successful, patient died. Yeah.
Sir, do you advocate any use of drugs whatsoever?
I'll refer to patients. I don't treat everyone, but everyone I accept, I expect to help. Depends on the condition. Let me answer his question about the X-ray. On a full spine X-ray, it's an excellent posture graph of the spine. As far as being of exceptional diagnostic value for bone disease, it's not very good. Not very good. Now, any X-ray is only as good as the one taking them anyway. plus his machine. That's got to have something to do with it. But you're talking about the exposure factors and all. Well, they have special shields to block out. With one shot now, they can block out for certain parts of the spine while they're at full exposure for other parts of the spine. And it will give you a nice reading. I've seen some excellent full spines, and I've seen some rotten ones too. Depends on who's doing it and how they do it. Now, what else? Anything else on that?
Do you do your own x-ray?
Yes. I don't take full spines. I used to, but I don't anymore. I find I get much better pictures by going to a smaller size, much more detailed.
That spot by palpation then?
Well, if they come in with a low back, I'm going to x-ray the low back. So,
Well, what if they would come in and say general type of disorder? Well, I guess no, I'm sure the answer to that. Well, if they came in and let's say they had a condition of asthma or something of that nature, would you know immediately that you would go to a specific?
a general area, yes, a general area between, well, it'd be upper cervical and upper dorsal areas that were involved. Medically speaking, what do they do for asthma? They give you a drug that will have an influence on one part of the nervous system, which allows the bronchial tubes to expand so they can breathe. And in not chiropractic books, but in medical books, you can read where if you take an asthma patient that has an acute attack of asthma, you can whack him right between the shoulders and he'll get over his attack. You can pound on him between the shoulders and he'll get over his attack. Right then. Why? Because they did the same thing the drug did without the use of the drug. They stimulated one set of nerves, which dilated the bronchial tubes temporarily. And that's all the drug is a temporary type of stimulant. They want you to take it continually and take these sprays. Well, I'm not advocating not doing it. It depends on the case again, but I do know, and I saw it in school, in dissection class, some people that had been taking these sprays over the years, and when they cut into their lungs, it's just one big glob of goop, green goop.
You said you were not totally against drugs. I mean, do you give injections?
No.
Are you qualified to do injections?
No, not qualified. I don't want to give them.
Do you believe that, or is it the philosophy of the chiropractic that immunizations are good or no good? For instance, for, say, such diseases as smallpox or polio.
All right. How much smallpox have we had in this country in the past 10 years? None. Why would you need a shot right now for smallpox? Where are you going to get it from?
Why that?
Yeah.
Protect those people who are not those.
But where are you going to get it from? See, that's a field in itself. I could spend 2 hours on that. I could. I'm not trying to evade it either. I'm just telling you I could. I could spend 2 hours. And I'm not saying if a person really feels like that is the answer, go ahead. But if I don't feel like that's the full answer, then I shouldn't be made to.
Let's forget about smallpox.
Yeah, that's right.
Because, the reason we don't have smallpox is because people have the immunization. That would be my contention.
Oh, I never have had a shot.
Let's take tetanus.
All right, take that.
What would you say in a case like that? Chiropractic adjustment instead of immunization?
Well, now you're talking two different things there. Wait a minute. Tetanus.
See, that's immediate. That could happen right now. I mean, we could get that. Smallpox is rather remote. Let's take something more immediate.
Right.
And serious.
Okay. All right.
Or let's say a penicillin antibiotic concept for syphilis.
All right, for syphilis. Just one little second. You can't be immunized from syphilis.
I said antibiotic.
Okay. Now what do you want to know about it? Do I recommend it? penicillin for syphilis? Yes. I recommend it for that. Of course, they don't get rid of it with it. It'll eventually come back sometime or other. They'll kill a lot of the tissue cells, but they won't 100% get rid of it. Well, now let's see here. Wait just a minute. I've got plenty of time if you do. I hate to just hit one part of it, and of course a lot of times I'll give the wrong. All right. There can be only 3 possible effects from inoculation. One is no effect at all. 2, a successful conclusion or injury. The belief that there is no effect in the cases which the procedure does not take, or that there is toleration, is based on illusion. Just as every impression reaching the cerebral cortex affects the mind, everything done to the body is registered in the nervous system, and every inoculation has its neurological effects just as truly as do the phenomena of psychology. Speransky has produced the evidence which proves the correctness of this assertion. We can therefore eliminate the first of our 3 possibilities, that no effect possibility, because it's never realized in practice. Once you've done it, and you can't vary from that. All right, but what of the cases which appear to yield to success? There are 5 possible explanations that have been suggested to account for what actually happens. Meaning, of course, if it's written in that way, 5 possible explanations that they don't really know anyway what happened. They theorize. And that's not very scientific either. The germ is embalmed, number 1. There's a difference between killing and destroying. A therapy may kill germs, but what becomes of the dead bacteria? According to Allen, the symptoms of syphilis are produced by a toxic combination of dead leukocytes and dead spirochetes. That is what we mean by embalming the germ. To be sure, in this instance, what is involved is chemotherapy rather than serum therapy, but the principle may be equally applicable, for all we know, to serum therapy. Perhaps it would furnish a clue to some of the suppurative processes regarded as a sequel of acute infectious disease. In other words, your reactions that come about after you've taken a drug that has cured this condition, you wind up coming up with something else, and they've got to give you the drug for that too. Now, number 2 of these 5 points, morbid material is preserved because the bacterial activity which would have destroyed it has been checked. This possibly alone renders the therapy questionable. Number 3, the morbid material is converted, an explanation which applies to vaccination. It was Pasteur's theory that immunity acquired either by an attack of the disease or by vaccination, a mild form of the disease artificially induced, results from exhaustion of the soil necessary for the growth of the pathogenic organisms. It is synonymous with what Fullman calls the abstraction theory of immunity. In vaccination, the morbid material is converted by an irrational procedure precipitately imposed upon the body, with what detrimental effects the victim may never know until disaster overtakes him. Irritation of any point of the complex network of the nervous system, declared Speransky, can invoke changes not only in the adjacent parts but also in the remote regions of the organism. and he leaves no doubt in the mind of the reader that he wishes to include under the term irritation the procedures of inoculation and vaccination. Number 4, the cell is conditioned or fortified so that it will no longer react to a specific characteristic way to a specific germ or antigen. This is a special case of Pavlov's, is the way it looks to me, principle of the conditioned reflex on the cellular level, which now becomes not a mere toy of science, but the clue to the major risk of serum therapy. The nervous system, which physiologically reacts to insult in an appropriate protective fashion, may be so considered that its reaction to a reception of the insult will be so bizarre that the individual is destroyed. Anaphylactic shock. It may not be far-fetched to say that the connection between these two events is, wait a minute. That has nothing to do with that last sentence anyway. Number 5, mutations are promoted in bacteria, in body fluids and tissue cells. That the bacteria may undergo mutation is to be inferred from the known fact that they change with changes of environment. Pasteur and Roux bred out the sporing characteristics of the B. anthracus, and it was never regained by descendants. Typical bacillus forms have been induced to assume coccus forms. Both forms have been rendered filterable. Only under specific environmental conditions and for specific periods do bacteria have any specificity. To bring about some utterly unpredictable change in bacteria within the body is to gamble with the consequences. And I can go on and on this immunization. But you asked my opinion, I think is what it was. Would I or wouldn't I? As long as everyone else is vaccinated, that suits me. That suits me.
What are your diagnostic procedures and treatment for cancer, specifically cervical cancer and breast cancer in women, and then the lung cancer in men? These are the more common types.
Yeah. Any diagnostic procedure will get the work done. Now, you said treatment. I have had many cancer patients in my office, but I've never treated a cancer. Now, I have worked on people with cancer that I knew had cancer, but not for cancer. For some of the symptoms that they got from cancer that I worked on, only. Because they found they got relief. They were in misery, temporary relief. So they'd already been sent home from the hospital to die. So I've never treated a cancer patient for cancer.
Have you prolonged their life by treating them for this?
I don't know.
What treatment?
No, not usually. Not usually. It's just a symptomatic thing.
For what specific symptom? You know, an example.
Pain.
Pain.
Right. And I found a lot of cancers too.
How did you diagnose cancer? What methods did you use?
I use X-ray. I use my eyes. I use my hands. And I try to use this to come up with the possibilities. For example, a person with low back pain, they come in and you ask them, well, how long have you had this? Well, Doc, I've had it for on and off for a number of months. Well, is it any worse now than what it was before? I said, well, I guess it is getting a little worse, but boy, it sure just pesters me to death. It just aches in there all the time. I said, well, can you get in any position where it relieves it? They say, well, one day I can get in one position and it'll relieve it a little bit, and then I'll have to get in another position and relieve it for a little bit, but it just keeps coming back and it nags and nags and nags. So before I work on them anyway, I'm going to X-ray. So it's kind of suspicious, depending on what clinical signs we see relating to this low back trouble. And sometimes that'll give you a little clue. And how it affects them at home and at work, and any loss of weight, of course. I've seen some that had so much cancer it's pathetic and hadn't lost 1 pound. So it doesn't always hold true. But if I find it in my office before it's been discovered anyplace else, I will refer them to someone. Because all anyone else can do anyway for cancer of the bone is dope them up. That's all they can do. Mrs. Wallace in Alabama. How long? A month? 3 months? 6 months? I don't care what they do to her. Doesn't matter. She's still going. All of us are going. It's just a question of how quick we're going. Now you talked about cancer of the cervix. Early cancer detection is very essential. Some cancers you can cut right out. Some cancers you can't cut at all. They'll just speed it up. Depends on what type. You've probably read in the paper, and I'm sure your professors read in the paper, and you might even know them. One medical nurse had nothing wrong with her until, I don't know exactly how long ago. I think she'd always had her, well, she had to. She was in the hospital over here. She had to have her yearly checkup, and the last checkup she had, everything was fine. She died last night of cancer. You never know. Depends on where it's going to hit. Doesn't matter what examination you have, you see. And they always get a lung x-ray for a hospital for TB, you see. They didn't see any lung cancer. And the way I understand it, 2 or 3 months later now she's dead from lung cancer.
Are there any chiropractic nurses?
Yes, there are some. I do not know of any personally, but I hear there are some.
How are they trained?
The Lincoln School, from the literature I read, did have some courses in that, and how far they've gotten along with it, I do not know. I do not know. There are a lot of women in chiropractic that are chiropractors. They've gone all the way through. Anyone else?
Do you treat pregnancy?
Treat?
Yeah, what is it?
Well, I usually wait 9 months and then start in. No, I have treated a woman all the way through pregnancy. She stopped on the way to the hospital, and she stopped 2 days later on the way home. Now, why? For what reason? See? Okay. She had a history of previous trouble carrying children, and always tremendous amount of low back pain. Always. And we, like I think I mentioned before, we never treat everyone alike. Now, I would not, of course, put her on her stomach and thrust on her back. That'd be idiotic. That'd be idiotic. There are just different ways to handle the case. I did work on the pelvis all the way through, and she didn't have any trouble. And she went to the hospital. She came out of the hospital. It was hurting again. So I called her on the way home. So she's fine. No trouble. Now, what age patients do I take? Is it between 20 and 40 or what? I've treated them 7 days old. I've treated them 96 years old.
What do you treat the 7-day-old one for?
Most birth injuries come from delivery. what age patients do I take? Is it between 20 and 40 or what? I've treated them 7 days old. I've treated them 96 years old.
What do you treat the 7-day-old one for?
Most birth injuries come from delivery. Some doctors do a lot of tugging when they should just sit back and wait. You ought to see some of the physicians that get that baby. Now, how would I treat a baby? Would I use my hand? My hand's longer than their spine. Tip ends of the thumb. Just like I would if I had an adult here on the table. How hard would I thrust? I only adjust anyone hard enough to get the job done. If it's this type of patient, little bitty, and I do find something that I consider to not be normal, then it's a very light manipulation.
Well, what specifically was it for?
As it turned out in one of these cases, anyone?
Yes,
Okay.
in a
It's usually always neck trouble. Neck trouble. They're tugging at their head or tugging at their feet or something of that nature. Though I have had them in there where the hip has been really tugged at too much.
Well, how do you ascertain that this is the problem?
Well, through clinical means, palpation, checking the use of what muscles they have, the rotation of the neck, rotation of the head, and so forth. There's anything I can detect what might be causing the patient to be in the condition they're in, that's all.
Is there any service provided by chiropractic that is not provided by conventional medicine?
Spinal manipulation.
Now,
let me
Are
finish.
you familiar with the branch of physiatry in conventional medicine, physical medicine?
Yeah, that's what I'm coming up with. It's a funny thing, you know. Back when I was in school, in every piece of medical literature I saw while I was in school, that's the way it appeared anyway, there's no such thing as a pinched nerve. That's what they said. All at once now, the last 8, 10 years, we've had pinched nerves. I wonder why they developed.
May I ask when you went to school?
50 to 55.
And you say that in medical literature at that time,
Oh, you had isolated cases of where that happened, where a medical doctor, I've got it all the way back to 1905, where a medical doctor advocated chiropractic adjustments at that time.
I'd like to take issue with this
Okay.
point because it was immediately following the Second World War that the special branch of physiatry was developed, and that was in the 40s. And I believe they were well aware of the concept of not only nerves from the spinal column, but nerves anywhere else in the body for that matter. So I just would
Right.
sort of correct
Okay.
that.
Well, I've got something written in here about it, but here's the point I was trying to get across. The major medical opinion as of the time I was in school was there was no such thing as a pinched nerve in their writings. Now, you had the individuals around that would tend to say something of that nature. But any official opinions, no. But since then, in the surgical journals, I've seen it in the surgical journals where they have pictures of patients laying around on the table with them opened up to their spinal cord. And they're in there talking about nerve pressure caused by subluxation and how the nerve has deteriorated. And I didn't operate on them, the medics operated on them. One day they say it's one way, and the next day they say it's the other way. Yeah.
Theoretically, then, anyone you would treat should show a positive myelogram. In other words, you should see impingement on a spinal nerve.
I know my x-ray teacher's a good one on this. He was in the x-ray department in the Army and saw hundreds a day of all types of x-rays. And he came up with a nice statistic. out of all of those that showed a positive disc involvement, where it was ruptured, where the dye leaked out around the ligaments and so forth, that on operation, 70% of them showed no evidence once they cut in there of having that, even though the dye did show. And I have seen more harm done from a myelogram than I have from any other type of diagnostic procedure. I've had people come in to me and they want to get rid of the headache. I say, well, what's your problem? They say, well, I went in the hospital to have my back checked. It was killing me. And they ran a myelogram on me. They said they might have a ruptured disc. And I say, well, fine. What did they find out? They said, well, they didn't find anything. I say, well, what's your problem? They say, well, my back trouble's gone now, but boy, I've got a headache. So
that's understandable.
Yeah, and some of them had it for a year afterwards too.
Well, they just probably didn't keep their head where they were informed to, and they also haven't given the dye a chance to be absorbed into the system.
That's right. Even the one that has been in there for a year.
Well, I have never heard any radiologist guarantee anyone having a myelogram that they wouldn't have a headache.
Right.
I mean, this is,
that's right.
This is like
that's right.
I agree with a cast on. They're not guaranteeing it.
Right. I don't guarantee anything either.
You said personally you have never treated a case of cancer. I see in a fair amount of writings other chiropractors claiming to do so. What is your opinion on that?
Oh, first, I don't know what they're claiming they can do, number one.
Cancer.
Well, you're taking in all kinds of cancers. Skin cancer is curable.
Through adjustment?
Through their therapy, whatever it is. It is treatable without cutting. But the other types of cancer, that's something else. And you send me any medical doctor that can treat every cancer case that comes in and can get them over it and get them back out on the street, and I'll pat him on the back. Now, I know there's certain types that they can operate and get the cancer out, and they'll never show up again if they catch it soon enough. But the other types, I don't care if they discovered it today, you're going to die from it. There's certain types, and they got different types.
Could you explore a little further this point of skin cancer, the cure that can be non-surgical?
I do not know their therapy. I just know something that I'll tell you where they do some of it. And that's at Spears Sanitarium in Denver, Colorado.
Spears is not defunct.
It's what?
Defunct. They've gone out of business.
When they go out of
I
business?
don't know when, but as of this summer they were out of business.
Is that right?
Setting up a nursing home there.
Is that right? I would have sworn I had a paper that was dated January. But I didn't. No, they're not out of business. I tell you what you're talking about, though. If you've ever seen any pictures of Spears Hospital, all right, there was one building that was uncompleted, wasn't it? Great big one. That was one they put into a nursing home. They worked out some deal and sold the thing, put it in a nursing home. The other part is still there. The chiropractic hospital is still there. So I get literature from them all the time. Do you like? Well, here's a paper right here. I don't know what the date of it is, sir. It might be an old one. No, January '68.
Sure. Could be that.
Yeah. Well, they did that. It's been 2, 3, 4 years ago anyway.
Could you briefly describe a code of ethics that seems to appear in the literature? I've never been able to find any major point to talk to you about except to say that chiropractic philosophy does have a code of ethics. Could you tell us what you're talking about?
Well, it'd go along the line of any ethical procedure in handling any patient, whether it's medical, osteopathy, or chiropractic. You do your best for your patient. And in this case, if they need referring, you refer them when they should be referred. Treat them right. Well, those are basically all they're talking about. They use a lot of words, but that's what they're talking about. Reasonable fees, reasonable this, reasonable that.
Would you consider in that area then the advertisement of free sperm x-rays as being in conflict with ethical principles?
There are two viewpoints on that. Now, one viewpoint is that the chiropractic profession has had to grow on its own. We've had no help whatsoever, ever, at the present, up to the present time, from the federal government in supplementing schools. The medical doctor, on the other hand, has his school building paid for by the state, out of my pocket. And I know he pays tuition, but that doesn't pay for 200 students a year. It doesn't pay for a $12 million building. And then he comes out, he goes into practice, and I'm not talking specifically about this hospital, because the way I understand it, this is a private hospital anyway. But even with it being a private hospital, he can open up a little office around the corner here and do 90% of his practice free out here. He'll just walk from room to room. Now he's got quite a jump on us. We're behind the 8 ball before we get started good. Now, you say about advertising free x-rays. I don't advocate free anything myself. But since you bring that up, do you, let me ask you a question. Do you advertise free x-rays yourself? I mean, do you advise free x-rays yourself? Would you like to see free x-rays? TB does it all the time. Vaccines are free. You go down the line, and if they see anything else wrong with you, they say, go down here and see the medical doctor. Who's doing the vaccinating? Well, a couple of, right here in town, they've got a couple of medics that go around to these different schools. I don't know how many times a year or whatnot, but they say they donate their time, but if they themselves see something wrong, they say, you better go see your family physician. They're donating their time free, and they're donating the vaccine free if they can't get some other organization to pay for it.
May I ask why this is necessary?
Well, it's necessary in this day and age. You understand, I don't advocate for myself. You understand? I'm trying to defend these other boys, and I wish I wouldn't do it. You see? Okay. Well, what was the question?
Well, I guess
that last
you
question.
said you don't approve of the advertising.
Yeah, from anyone. I don't care if it's from a medical doctor or not.
Well,
now, I know.
About chiropractors today.
Okay. I don't advocate it, and I don't think it's wholly acceptable. The way our society is run now, but it's still done, and I will defend it as long as the medical doctors advertise in different ways. Now, I know what you won't know what ways. Well, that was one way. I was talking about the shots and the vaccines, free down the line. And then you open up Saturday Evening Post, and you've got a full-page ad in there from Lily's telling you how good their drugs are and how much they're helping the people, and make sure they show this little sick kid running down the street and help the atmosphere, or maybe it's a sickly condition, and down there it always says go see your physician. Now I know the medic didn't put it in there, but if they didn't put it in there, they'd be in trouble with the medic.
On the state board exam that you have to pass to become licensed, on the medical written part that you were talking about, what's the cutoff point on that? Like below?
Percentage? Usually 75%, usually.
And what does the chiropractic therapeutic exam consist of, and what is its cutoff point?
It's probably the same cutoff, but it consists of everything dealing with chiropractic. See, when we go back to what's taught in the school, that would come under then. It wouldn't be the anatomy or anything. It would be diagnosis, psychology, X-rays. Now this is getting away from the basic sciences now. See that you were talking about anatomy, chemistry, microbiology, and preventive medicine type pathology and physiology. Would be the diagnosis, psychology, X-ray principle, spinal examination technique, orthopedics, practice, chiropractic management, obstetrics. Now why would we study obstetrics? State law says we have to. That's why.
What do you do with it after you study it? What do you do with it after you study it?
In some states they can do more than what they can do in other states. Well, we should know it anyway as a general background. Like this particular patient I was talking about, if I knew nothing about it, if I couldn't even tell she was pregnant, I'd be in trouble. So, yeah. Anything
How
else?
would you tell the difference between a thoracic root syndrome and a true case of angina pectoris?
I won't get detailed on that.
And I'm concerned because if this person really does have angina pectoris, I think they're in trouble.
Well, angina won't kill him. Angina won't kill him. Funny thing, I had that marked here.
The symptoms are
Very similar.
very similar.
That's right.
Somebody came
You'd have to go through all the clinical diagnoses to really come out with a true picture of what's happened.
If they had angina, would you handle it?
Oh, absolutely. Right now. Right now. What would the medical doctor do? Give them nitroglycerin.
But you can't. You don't get drugs.
Well, all right. What do they give them nitroglycerin for? Strengthen the heartbeat. I can do the same thing with an adjustment.
Nitro for the dilation of the coronary vessels. So what do you do then?
Work through the nervous system and do the same thing.
How?
Well, manipulation of the upper thoracic vertebra and sometimes the first cervical.
What do you mean? Then you work with the sympathetic nervous system
And the parasympathetic.
And those, I mean, you work with the autonomic.
Right. Right. See, medicine is well, it is. Medicines, as we think of it, they treat stomach trouble, they treat liver trouble, they treat this, they treat that. I'm not talking about antibiotics now, completely away from that. When they give these drugs, they're either trying to influence the parasympathetic or the sympathetic, one of the two. Now, you get into other things with medicine. You can go on into surgery, and then you go into first aid. Which, let me ask you this: if you fell down and made a gash in your leg about that big, would you go to a chiropractor or a medical doctor? Go ahead, say it. You go to a medical doctor. Why? See? Now, I'm not advocating the treatment of this, but what I'm saying is the only reason you go to the medical doctor is because he has experienced in first aid, which is what it would be in taking care of this, would be first aid. They teach first aid at the Red Cross course down here, but you don't go down there to get treated. So you go to the medic. He's got their equipment. He studied with it in his hospital training, his class studies, and you would pick on him before you pick on anyone else. He's got the proper equipment to do it. But there's nothing to sewing anyone up, see, as far as a cut is concerned. Now, you get down into the muscle. I know a lot of medics right here in town won't sew up anything. They won't put one stitch in anyone. and send them somebody else. They don't mess with them. Are we through? Don't get too specific on me. You devil.
Well, I hate to be too specific.
That's dirty.
That would bother me. What types of mechanical equipment do you use in your practice, other than X-ray?
Mechanical? Well, now you have to understand that it's not for the treatment of patients.
Either therapeutic or diagnostic.
It's for the preparation of the spinal column or joints of the body for manipulation. I use ultrasound and diathermy, sine wave, and galvanic, depending on the case. Am I trained in them? Yeah, I'm trained in them.
I've got a picture of Dr. Metzger in Newcastle on.
Well, I've got a few pictures too, but I hide them.
He's got a sphygmomanometer on his desk in a picture. I was wondering what in the world he'd be using that.
Well, you like to.
Or is there really a chiropractic use?
Well, if someone walked into your house and sat down in the chair, and their ears looked like two red lights in a Christmas tree, you would do one of two things. So you would try to get them back out the front door, or you would go call the doctor. I don't care which, medical or chiropractic, it doesn't matter. What I'm saying is you'd suspect he had high blood pressure and he was going to pop something if he didn't watch out. So we check the blood pressure. It's not a treatment, it's a diagnostic procedure. That's all. If we didn't use every diagnostic procedure that is available and something went wrong, it'd be our fault. It'd have to be our fault because they're available. Anyone can get them.
Is the high blood pressure a symptom of the subluxation, or is the subluxation, or is it?
Not always. I've seen the case where it was a case where the high blood pressure came up all at once. And usually we can trace that right down to a specific, adjusted accordingly, and it'll go immediately down and stay down. But a lot of these cases that come in, they didn't. It has developed over a period of years. It's developed over a period of years, and blood pressure doesn't just come about just because it wants to do something different, and be high one day and low the next. It came about because of something going wrong in the body. Liver, kidney, heart itself, or maybe something in the brain. So it depends on the case. Everyone's different. I don't stereotype anyone that walks in the door. And I never quit diagnosing either. If they come in and through my analysis, I feel it's such and such, I don't just leave it there and just continue to work accordingly on that specific. I'll watch and see if there are any other symptoms that might come up that would change my thoughts on that.
When you're talking about diagnostic tests, I was wondering, do you do urinalysis and blood
Yes.
tests? Do you do them yourself?
They're very simple too, and there's nothing complicated about them. We had it all in school. In fact, we had them on state tests. I took a North Carolina examination, which is given by a chiropractic board. 22 exams in 3 days, starting at 7 in the morning, running until 8 or 9 at night, 3 days, covering everything.
What is your opinion as a chiropractor of the heart transplant?
Of heart transplant? I'm not saying anything's wrong with them, but let them use somebody else for a guinea pig before they start cutting on me. How many live? How long would these patients have lived without that surgery? See, you don't know. Well, one thing you do know, all but one's dead. That's the only thing you can go by. So it's up to the individual. If they think that's what they want, fine.
I was wondering, if you had a patient that was having more back pain, which is due to kidney trouble, which may be kidney failure, would you refer them to a doctor if you felt like
Kidney failure? Yes.
How would you go about? I mean, would you keep treating them to the point where, I mean, it was very, very evident?
It depends on what else was involved there. If it's strictly the kidney failure, and the kidney was beyond repair of any kind, when they came into my office and I found this, there'd be no need to treat them anyway. Now, drugs might keep them alive. Might. Depends on the case. You have to qualify everything. It'd be nice if you could just say, well, here comes Joe Blow. I know that it's this or it's that, and I'll just hit him this way, and here comes Joe Blow number 2, and I'll treat him exactly the same. You can't treat them all the same.
Well, I bring more questions.
I thought this was going to be 30 minutes. There's 3 30 minutes, wasn't it?
Well, we'd really like to thank you, Dr. Landon, for giving us your time, and you have increased our knowledge to public health, especially your philosophy of chiropractic.
All right, thank you. Appreciate it very much.